In biological dentistry, we don't look at the leaf. We're going to look at the whole forest. These people are coming in with multiple health issues that have been progressively getting worse, chronic disease. I start looking at an x-ray, I start looking into their teeth, and then I start talking about their body. Hey, this tooth is connected to this group of organs. How's that going? Oh, it's terrible. Hey, your sleep patterns, your airway, how are you getting by? And these people are always tired and just like chronically like fatigue, and their body is exhausted because it's putting up with a lot of barriers, infections that are preventing it from getting into that deep parasympathetic and being able to heal themselves. I've been at this for a long time, and I thought more dentists would be catching on. I wish it continues to happen. There's not enough of us for the population that we have, the amount of chronic disease and long-term bad fillings and bad stuff out there. There's not enough of us. So outreach and education is a big deal.
Welcome, everyone. Dr. Mercola helping you take control of your health. And today we are joined by my personal dentist, Dr. Carlo Litano. And he is outside of Tampa.
Yeah, St. Petersburg, yeah.
St. Petersburg. And as he just moved into a new office, actually I have yet to see yet. But it's really nice, I understand. And he is able to meet with us today because a hurricane has just shifted, literally probably an hour or two prior to this, shifted to where he lives now. And I'm on the other side of the state, so it escaped me by a long shot. So let me give you a little history how we first connected. Was right around the beginning of the COVID pandemic. It was, I believe, 2020. Maybe March, somewhere in that time frame. I had just gotten back from a retreat in Mexico, a health retreat, and they did some diagnostic work there, which included a dental evaluation. To my shock and surprise, I had a dental abscess that needed remediation, dental surgery. And when I returned from that clinic, basically the entire country shut down that week. Everything was shut down and closed. And so I was in a dilemma. I really didn't know where to go. I really couldn't fly that far because I think even though I can't recall it, but it was a radical restriction in travel for everything. And through my friend who's been on this podcast many times, and Charlie Brown, who is the head of the Consumers for Dental Choice, he helped me identify one of the best dentists in the entire state of Florida, and one that specifically skilled in what I needed, which was a dental surgeon, because he needed to do some surgery for me. So that's how I found Dr. Litano. And I was so impressed with his office, very professional. And even that was his earlier office, and his new one is even better, but he's got state-of-the-art equipment, including a 3D CD cone. There's probably another word for it, that provides the most remarkable analysis of your jaw problems that you could possibly, and your airway. I was so impressed with it. So anyway, he did surgery for me and got an implant. And really, I don't think there's a better one around, certainly in my state, to have this dialogue. So we're going to talk about some general things that would help you navigate your dental challenges. So with all that preface, welcome and thank you for joining us today.
Thank you, Dr. Mercola. I've been a dentist now almost 20 years, and I was lucky that right at the beginning, I found a holistic dentist mentor in Portland, Oregon. And ever since, you get your eyes open and you can't unclose them,
Mm-hmm.
Once you know, you can't unknow. And I was able to follow that journey for many decades, and eventually come back to Florida. And I've had my own holistic practice coming up on almost 10 years now.
Mm-hmm. So was there any challenges that you experienced in your transition from conventional dentistry to what you're doing now?
I was fortunate, but it was a long road of courses, learning Ozone, learning PRF.
PRF, what is that?
PRF, platelet-rich fibrin.
Okay, okay. Because
Yes.
usually it's called PRP, platelet-rich plasma.
Yes, it evolved into PRF like 10 years after that.
Hmm.
And doing a lot of training. Most of our training now is in Switzerland. We go there once a year. It's coming up in October. And we re up our training, updates in surgical protocols. But more about my journey. I didn't have a lot of dentists start into this because they have their own dental issues. And in my case, it was my mom having dental issues. And I graduated school in Fort Lauderdale, and I didn't have enough skills to be able to help my own mother. It took about 10 years for me to feel comfortable to be able to help her and move forward and keep moving forward on my journey. I was lucky to have multiple mentors along the way to help shape how we deliver dentistry. But like the advantage was like I got so many perspectives. It was really the Swiss that put it all together into an integrated protocol,
Hmm.
and that's with Dr. Klinghardt, with Dr. Volz, and it's really changed the way we start, perform, and follow up on dental care.
So maybe you could give your perspective and summarize the differences between a conventional dentist and one who might consider themselves a biological dentist.
So in biological dentistry, we don't look at the leaf. We're going to look at the whole forest. You know, these people are coming in with multiple health issues that have been progressively getting worse, chronic disease. So I start looking at an X-ray. I start looking into their teeth, and then I start talking about their body. Hey, this tooth is connected to this group of organs. How's that going? It's like, oh, it's terrible. Hey, your sleep patterns, your airway, how are you getting by? And you know, these people are always tired and just like chronically like fatigue, and their body is exhausted because it's putting up with a lot of barriers, infections that are preventing it from getting into that deep parasympathetic and being able to heal themselves.
So, as you're making this assessment, you mentioned Dr. Voll, who is really the early pioneers of EAV, which is named after him, electroacupuncture, according to Voll, which is the precursor to many of these similar types of equipment that exist today. Many of them are computerized, and I'm not certain how equivalent they are, but certainly they're faster. One of my early mentors was in 1995, Dr. Thomas Stone, who has since passed, and he had one of the EAV devices, was trained personally by Dr. Voll, and and I had many experiences with him. Usually at night after I worked, finished my training, not my training, my practice, it would be an hour or two, but it was very long. You examine each finger tip, the tip and the knuckles and the acupuncture meridian points, and you have to press in. It was usually somewhat painful, and it took a long time to figure
Oh,
things
wow.
out and balance it. So I don't know if you've ever gone through that type of Dr. Voll uh, assessment before, but I
Yeah,
wonder what you're using.
I'm familiar with that. We used to do a lot of muscle testing. We reference back to imaging. We
Now,
had, yeah,
and,
with the electric EFE stuff, we let the patient's practitioner manage that.
oh,
So
okay.
they're usually coming in already with the reports. And I'm familiar with that, Dr. Volz, you're talking about. I was referring to Dr. Carl Ulrich Volz. He's the inventor
Oh,
of the ceramic implants. Yeah.
it's a different German dentist.
Yeah.
Okay, I didn't. I'm sorry, I mixed him up. I thought that because he's sort of the father of electrical assessment of the meridian. So,
Yeah.
okay, good. So, you mentioned the imaging. So maybe you can discuss some of the marvelous technology of this. What is the name of the CD cone scan,
So it's
3D?
computer beam, computer tomography, CBCT,
Hmm.
and it gives me the ability to map the brain in 3D, like the whole skull. So
Hmm.
I'm looking at the jaw, the airway, masses in the jaw, how the upper teeth are. We'll get a lot of like infections on an upper tooth that goes into the sinus. So this person's having ear problems, things like that. And we were able to slice the imagery in multiple planes in multiple dimensions to catch things that would get lost. something common we find is they remove a wisdom tooth and they leave a root tip behind. They remove
Mm-hmm.
a root canal. They remove the piece of a root canal. It's still in there. So it's still a source of inflammation embedded in the bone, triggering autoimmune situations, and it's amazing all the stuff we find in people's jaws.
Yeah, and it's even more impressive than you describe, because you can actually take this image and rotate it around and look at it from all these different angles, upside
Mm-hmm.
down even, and turn it around 360 degrees, and
Mm-hmm.
see things you would normally never visualize on a 2D X-ray. It's truly remarkable, truly the 21st century innovation. And I was particularly impressed with its ability to identify obstructed airways, which would lead to potentially sleep apnea. And you can see exactly if you're at risk, and the dimensions of your airway to know that.
Yeah. Yeah. Sleep apnea is just the beginning. These people stop oxygenating at night.
Mm-hmm.
They go 95, 90, 85. A code blue in the hospital. It's like you can't hold your breath and bring your O2 levels that low. But this is how these people sleep and rest, and they're snoring, and they're clenching, and they're doing all these compensatory mechanisms, but the root cause being is that they developed into a body that has a much smaller airway than they're supposed to.
Yeah, sometimes, as I understand it, at least the physiology, so short bursts or periods of the sleep apnea, even getting down into the 80s for PO2 is actually beneficial. It's somewhat like an exercise.
Ah,
In fact, it's given a term, intermittent hypoxia training, especially if you integrate it with uh, hyperoxia afterwards. But so the beginning stages of sleep actually improves your health, but very shortly thereafter you pass the threshold and you start declining your health because it's done.
ah,
It's a good thing done in exercise. It's like exercise. Like if you ran a marathon every day for a month, you'd probably run into some problems. But
yeah,
but if you just do a few miles a few times a week, you're probably going to be okay. Because
yeah.
anything done in excess is problematic.
Uh-huh.
So what is a typical person that sees you? What are they coming in with?
We've got people, locals, trying to get themselves established. You just moved into Florida. We're getting people from like a 2-hour radius, Naples, Ocala, the villages. Patients are coming in from other states, from other parts of the states. They're flying in from other countries. We get them assessed, figure out, we triage primary, what's the worst thing that can hurt them. We usually try to do metals first because we don't want healing when there's metal ions around. We're just going to make dirty bone. Our goal is to clear these obstacles, clear the metal, clear the mercury, clear the metal crowns that are blocking these meridians, and hit the reset button so they can start healing. Their body is chronically inflamed. Their body is tired. Their immune system is on the edge. They used to be young, they used to be strong, and now it's been wearing on them, and their envelope to be able to handle all these stresses kind of keeps getting narrow and narrow. Not that the body has changed, but their ability to compensate for them, and they start to feel it. They start have chronic symptoms, chronic disease. A lot of them turn into like thyroid issues, and like I said, immune disorders. And okay, and then we start clearing them. Hey, I'm getting my vitamin D in the right place. I feel better. Hey, I'm starting to get my metals out. I'm feeling better. My dreams are changing. My stress levels are adapting. And then we go into the removal of root canals, replacement with implants, cleaning of cavitations. But we slowly build them up so they can handle all these things.
What would you say that, or caution people who are seeing a non-biological dentist about some of the concerns? I think maybe one of the things you can start with is the dangers of having your silver mercury fillings removed by a non-biological dentist, because I certainly made that mistake uh, in the 90s actually, and it precipitated some problems with compromised my kidney function because I must have had close to 20 amalgam fillings that were removed. My mercury fillings were removed in the mid 90s, but I had 20 at least, and they were removed all at once, if you can imagine,
Wow.
with no precautions, no vacuum, no rubber dams. And imagine that I had complications from that. Well, I did. So maybe they weren't all. It might have been 2 visits, but it certainly wasn't. And it wasn't segregated in quadrants. So why don't you? I think that's probably a big issue because there is almost never a justification to keep a mercury filling in your mouth unless it's finances. And some people that's a significant issue because there's cost involved. This is not done for free, and that's one of the reasons we're so delighted that Charlie Brown has catalyzed, and I've helped fund him, and many people on the site have donated his efforts to remove mercury from dentistry because it's just an antiquated substance, should never, never, never be used. It's left over from the Civil War years and has become entrenched as a toxic substitute for far superior alternatives. So why don't you discuss the dangers and the concerns about that, and then maybe after that you can pivot to some of the alternatives that people should consider.
Mm-hmm. So mercury fillings are, beyond being metal, they're 51% mercury, and metals are conductors. So the way they kind of affect the body is very severe. Like they still do mercury fillings on kids and less on adults now. But I'm removing every other day. I'm removing mercury. I remove crowns and then metal crowns, and then underneath is a mercury filling. So now you got a positive noble metal sitting on top of a negative mercury metal, and you got your own little battery on the stomach meridian right here. And then like a year later, patient goes into IBS or some other condition. A lot of times it's front teeth on women, and it's infertility, irregular periods, and just as examples. Nowadays, we use in our office and most holistic offices, we're using orgo-ceramic fillings. We no longer use composite resins, those white fillings from the 90s. They are plastic petroleum derivatives and will have BPA gas off from them. So we only use,
which is an EDC, an endocrine disrupting chemical, because it activates estrogen receptors. So would that type of composite, would zirconium be classified in that, or is that another?
The orgoceramic is silicon dioxide chemistry, which is sand or glass. Yeah.
Wow.
Mm-hmm.
I don't. Did I get that when I was there?
Yeah.
Oh, I did get it. I can't even remember.
We've been doing those for a long time now.
Okay.
And they're maybe like 8 years out, but and most fillings are rated to last 10, 12, 15 years. I'm hoping we're going to get out 20 years out of these fillings, maybe more.
And how does that compare to the previous composites that were being used?
They have issues with, like, after 10 years, the margin starts to break down. The filling is fine, but the bond starts to break. And then we get this little microscopic gap that bacteria and bugs will get into. And so we have to replace them earlier. These fillings, it's not just like placing a filling and you're done. You got to place it the right way, and also take in mind the bite. In your case, like you had all those fillings removed, and that is a recipe for messing up the bite, going into neuromuscular spasms, headaches, and all. We hardly ever do a whole mouth at once. Usually, is a quadrant at a time. If there's just a few fillings, we'll just do half a mouth. We'll wait for those fillings to calm down. It's normal to have sensitivity that goes away after a week or so, and then we do the other side. Because if you can't chew on both sides, people aren't happy.
Yeah, and as you're speaking, I'm remembering my experience in your office, and I was beyond delighted to find out that you had equipment and instruments that eliminated the mold that is typically made when you create an impression. You do a digital analysis. It's like a CAD scanner, a 3D CAD scanner that precisely measures to probably sub-millimeters the dimensions of characteristics of the surface of the tooth.
Microns.
Okay.
Microns.
And microns is a sub-millimeter, by the way. I was correct.
When we're doing ceramics and they go off to the lab is promising up to 6 microns, where human hair is 100 microns. Now that's the standard now, and everything is sealed and there's no gaps. It's really wonderful.
Yeah, I thought so. And it's just much less uncomfortable because getting those, I have so much angst remembering and memories of getting, because I've had a lot of dental work, and those, I never enjoyed those impressions. Never.
Yeah.
And they're gone now. They're just in past. So, and how common is that technology in dental offices?
It's cut down a lot of time between things. And
Hmm.
before with the mold, the lab would make the lab is digital, so they make a copy of the mold. So now you got a copy of a copy. So let's just go direct and from the source, and we take the impression in the chair, and it goes directly to the lab. It goes directly to our 3D printers, and like on the spot, things that used to take us 2 weeks now take us an hour, and like it's
That's just great.
yeah.
But what percentage of dental offices are using this technology? Is it like half? Or is it
I
a
would say
quarter,
half.
10%?
I would say
Okay.
half. Yeah.
No, that's good to know. That's really good to know. But I
Yeah.
was impressed because I typically don't go to the dentist a lot, and was
Hmm.
pleasantly surprised at innovation.
Yeah.
Along with that CD3D cone scan, it's one of the most impressive technologies I've seen. Especially when you're seeing your own jaw and mouth and airway, which is
Yeah.
fantastic.
Yeah. We're getting a lot of cancer patients from clinics all over Florida and the country, and
Hmm.
these patients are already diagnosed. They already know a lot of stuff that's going on. They've been learning about dentistry from sources like you and the internet. And I do phone consultations. They're coming in, and I'm showing them, and I'm sending their doctors the pictures very clearly outlined of infections, cavitations, how inflammation is going up into the sinus. I'm seeing people that are having surgeries like sinus surgeries they never needed.
Hmm.
And like, hey, this whole thing, the whole time nobody looked at your tooth, that you have an abscess going into your sinus. Of course you can't breathe. Of course it's full of a mucus cyst.
Yeah, yeah. So you're helping a lot of people get into the basics, and physicians aren't traditionally trained enough in appreciation of the contribution that the dental health has to health. It's quite enormous, especially if you develop complications due to poor oral hygiene or for whatever reason you get some periodontitis, gingivitis. It creates this whole uh, wide array of pathology in your mouth, which contributes to disease and definitely accelerates things in the wrong direction.
Yep.
Would you
Yep.
agree? Yeah.
Yeah, yeah, it's been, and then my own father and my brother are physicians, and we talk, and they're more holistic leaned, but that embedded tradition, it's really hard to let go of. It's what do you call it? It's you really got to change the path on that. It's a whole way of thinking,
Mhm.
and you got to be able to let go and do what's really best for the patient.
Yeah. So what are the most common reasons that people come to see you?
Infections. Most of the practice is a surgical practice, so we're going in and cleaning and cleaning, broken teeth, severe infections. Sometimes people get infections and they don't feel pain. There's all these mechanisms inside of us that keep us going,
Yeah, yeah.
and it's not building up pressure, so it doesn't hurt. Yeah, there's a little hole, but I clean it once in a while. But it's really disrupting. It's not an infection under your skin, inside of muscle. When you have an infection inside of bone, which is the deepest layer of the body, it really freaks out the body, and it starts doing funny things.
Hmm. Actually, that was my case. I had no pain with my infection. This it
Hmm.
was a periapical abscess, I believe,
Yeah.
and it was definitely destroying my health. And I had seen, because my blood work, which I do at least once a month, that my HSCRP, C-reactive protein, had gone up, and I had no idea why because nothing was obvious, but it was this infection that you took care of. Now, and of course, dental caries being another type of infection, probably the most common. Most people typically don't get abscess in their tooth, but they do. It's probably the most. Would you agree it's the most common reason why people have their teeth pulled?
Um, yeah, cavities. We have a pediatric dentist. I used to do a lot of pediatrics, and you have these holistic households, with clean diets, and all of a sudden, little guys get a lot of cavities. And so, yeah, we rearrange the biome. It's not just filling. Anybody can fill a tooth, and we have good materials, and we use ozone. But hey, let's look at the diet. Let's look at the pH levels. Let's introduce some oral probiotics, gut probiotics, oral probiotics, sinus probiotics, and let's really see what's going on. Let's change the biome. Let's help the gut. And these kids recover, and I'm seeing them as teenagers now, and young adults with impeccable airway and bite schemes and situations where, like, we can intercept to avoid orthodontics with epigenetics. There's a bunch of things that we can do to avoid heavy dental usage as young adults. So these kids are growing up with nice wide mouths, good breathing, good stamina, and they're no longer getting cavities. They usually get cavities when they go to college and they get stressed out and bad eating habits. They'll get cavities again, but a lot of the times they settle out. The most other common procedures besides restorative dentistry, fillings, crowns, and surgery is going to be dental cavitations, like storage areas of where all that
Mhm.
toxicity ended up.
Yeah. So you'd mentioned ozone, and when I was in your office, I had some challenges with periodontitis, and ozone is one of the treatments for it. And you helped create a mold for me that I was able to hook up to an ozone generator device on one end, and the other was a dental aspirator. So, and you have to use something like that because you don't really ever want to breathe in ozone. Not a good idea. It's
Yeah,
not. It's toxic to your lungs, but it's also toxic to your colon too. A lot of people use rectal ozone as a form of therapy, and although it may be useful systemically, it destroys the gut microbiome. Absolutely destroys it,
hmm
which is
hmm
never a good idea because you're almost burning down the house to kill a roach.
yeah, yeah. With you're mentioning hyperbaric ozone, and
That's
these are,
another one too. Yeah,
yeah, it's
yeah.
not for
No,
the
no, no,
body.
no, not hyperbaric. Did I say hyperbaric?
So when you have the tray becomes a hyperbaric area. The
Oh, I
pressure is
didn't know.
higher, but
Really, I
then,
didn't know that.
yeah,
I didn't
yeah.
know that.
So you've been doing hyperbaric ozone for your mouth and your tissues and teeth. So, but a lot of the times, like, gum disease and periodontitis has been around forever, but
Hmm.
we don't see that much of it because, like, it's facilitated. Those bugs are facilitated by the metals. Those bugs are facilitated by the root canals. There's sort of their little niche they can go and hide when
Hmm.
you clean up. And they just come back out and attack all the same tissues. With the root canals being gone, with the metals, then we can get to the biome, and then it's a lot easier to treat and manage the pH and all that stuff.
Now, when I had last visited you, and I haven't been there for a while because I did a really great job, and I have a local dentist who does my dental cleanings, which has actually decreased quite a bit since I've integrated some scaling into my regimen because I had to go every 3 months. I go once every 6 to 9 months, and there's really very little to no plaque. So I'm grateful for that. But at the time I did see you, I was didn't really fully appreciate the importance of carbohydrates in the diet, and I was more of a low carb diet. That somewhere on the order of 50 grams a day. Now I'm up to 5, 6, 700 grams of carbohydrate a day,
Mm-hmm.
which is quite a bit of difference. But I'm wondering if you do a dietary history or identify people who see you as to what they're doing for their diet, like vegan or low carb or keto, carnivore. Do you do that type of assessment? If you do, have you noticed any differences in the conditions that the people are presenting with?
Not so much. Yes, it is a factor, but, like, if everybody is different, and
Mm-hmm.
then, like, hey, I'm gonna do a carnivore diet, but I'm doing high pH water, like I'm doing alkaline water, no sugars. I'm like, okay, the key is keeping the body alkaline. When people get overly acidic and they're having inflammatory foods, it's it becomes a function of the immune system. These
Mm-hmm.
immune system gets weakened, and then bugs start coming out, and they find a home and a place that they can sit at. Um, so we have also we have vegans, we have people with regular diets, and kids are very hard to manage. But as long as we kind of address other aspects of their lives,
Mm-hmm.
some people are more sensitive to EMF than others.
Oh
So
yeah.
we're able to kind of, hey, you gotta, I'm watching you, I'm reading you, I'm looking at your history, and there's these things they're not that hard, but they're sort of blocking you from really kind of narrowing down the biome, the flora.
Okay. The reason I mentioned that is you talked about being alkaline in the blood, and I think it's a noble goal. And typically, what the reason why it's not is especially when you eat low carb, is your body's more reliant on generating energy uh, inside the cell, outside the mitochondria in this process called glycolysis, which liberates lactic acid, and the lactic acid is excreted outside the cell into the blood, and that contributes to the acid blood, and plays a big role in this relatively significant metabolic acidosis. And you can neutralize that with fruits and vegetables, even things like sodium bicarb, baking soda. But the key thing is to optimize your metabolism. And if you're doing that, then you tend not to rely as much on glycolysis and more mitochondrial energy, which creates CO2, which is the exact opposite. It actually causes a increase in the pH, making yourself more alkaline. So that's the reason I mentioned it, because I think there's a connection there, but if you're not looking for it specifically, you may not notice it.
Yeah.
Yeah.
Something I'll bring up about the patients we're seeing, they're trying to, the decay, the metals, the infections are keeping them acidic, and and it's like triggering their adrenals, and they're always stressed out, and they don't respond well to stress. And these things are clear once I put it up on the big screen for the X-ray. They like, it's, I see a lot of, I ask them to come with their husbands and with their wives. I'm like, so that the partner can understand, what they've been really feeling. We don't live inside other people's bodies, and a lot of people kind of like don't share it so much and don't want to be a burden. But these people are pretty sick, and it's better when they work together as a couple to try to resolve these things.
So, what would you consider some of the biggest innovations and advances in biological dentistry in the last few years?
Oh, in the last few years, the big advance has been lasers. I don't have to numb a lot of people sometimes,
Really?
and we hardly use the drill now. Now we
Really? Oh, I bet a lot of people would be very surprised and
yeah,
delighted to hear about that.
yeah. So it's called an erbium laser and an ND YAG laser,
Mm-hmm.
and the erbium laser, it's like burst of energy, kind of like if you hold the candle, it's gonna burn, but if you go around it with it doesn't burn. So this has like some really cool thermal properties that I'm able to um, create holes into bone without drilling. Now we're using light, so
Wow.
there's a
Wow.
lot less sounds, and we don't only use it to drill holes in teeth and clean cavities. It disinfects the surface. These little explosions
Mhm.
disinfect the surface, and
Wow.
then we ozonate it, and then we put the filling on top. But we use it on cleanings. We use it on surgery. After we remove the tooth, we got to clean the bone because the bone becomes kind of dirty. So we remove like zero point 0.1 millimeters on the whole cortical of the inside of the socket, and
Hmm.
then we're using the laser in water to clean it. You're familiar with the cavitation bubbles, like on the edge of a propeller.
Hmm.
So there's a lot of energy in these little bubbles. So the
Hmm.
laser can create these bubbles inside the socket, and when the bubble explodes, it's lysing, rupturing the walls of bacteria, parasites, and viruses. And now we're going to flush it out with ozonated water, and then we're going to blast it with ozone gas. Ozone gas is specific to anaerobic bacteria. It does not hurt the cells, and now the socket is disinfected. Now I primed the walls of the socket with plasma that we collected from the PRF from the patient, and then we're filling in not with synthetic bone, not with cadaver bone, not with cow bone. We're filling it back in with the patient's own fibrin and platelets. This forms a matrix that eventually bone cells will mature in, and the patient will grow back their own bone. No extra stuff.
Yeah, in some ways, it's like stem cells. It's a derivative of stem cells, and
Hmm.
and it's much easier because the source is your blood. And
Yeah.
as I recall, I think
Hmm.
you did it for me. You collect the blood at the visit, and you spin it down and process it to create it. Is that correct?
Hmm. No
All right.
additives. It's just
Yeah.
physical energy and density.
Yeah. So, can maybe if you can differentiate between PRF platelet rich fibrin and PRP platelet rich
Um,
plasma.
yeah, the protocols evolved, the amount of revolutions change, The angles of the tubes inside the centrifuge changed. And again, we're collecting growth factors, stem cells, concentrated immune components, and the solids are going to be the a much higher fibrin concentration and platelets. Fibrins is that scaffolding that cells will mature on top of.
So what have you noticed since you've been using this type of approach?
Oh, okay. It's shocking. Okay. So we've been doing PRF for 8, 9 years, and
Mm-hmm.
overnight, the secondary infection rate went down. Anytime anybody goes to a dentist, you are running a risk of 30% chance of postoperatively secondary infection,
Mm-hmm.
sometimes called dry socket. Dry
Mm-hmm.
socket is very, very painful, and that's an automatic future cavitation.
Mm-hmm.
Yeah, the bone dies, and then it
Yes.
just fills in with tissue, and it just becomes hollow. So overnight, the secondary infection rate went down, and then it doesn't hurt. It's a little sore because you had a tooth removed, but it people kind of freak out. Doc, you did this big surgery on me, and I'm not having pain. I don't have to take pain meds. I'm only taking the homeopathics and the recovery kit and some herbals, and we really do not use antibiotics in this office. We mostly rely on herbals, and 80% of the time it's working, and people are just like, all right, I like this no antibiotics, I like this no pain situation, and then they refer their moms and their aunts and all that stuff.
That's great. That's great.
Mm-hmm.
So, and what do you see the difference when using the laser and the drill? I mean, in my mind, one of the components that you alluded to was that sound, that drill, and that's a frequency, and that's
Mm-hmm.
not a beneficial frequency to humans at
No,
all. That
no.
frequency that you're hearing. So that alone, aside from the destructive potential and damage, and the removal of absolutely large amounts of unnecessary tissue that didn't need to be removed.
Correct. Dr. Mercola, like a dentist with a drill, it's removing teeth through friction.
Mm-hmm.
And friction creates heat. So
Mm-hmm.
sometimes it's not the violence of it, but like the thermal buildup in the tooth hooks the nerve and it dies. Like
Oh,
you get a
wow.
and then it dies like a month later or 2 months later. That's a using an old instrument, not sharp, and
Mm-hmm.
then it overwhelms the crystal. So that
The crystal being the tooth.
the tooth, yeah,
Yeah, yeah.
yeah.
So would you go so far? I think I would. But do you believe that using a dental drill in this day and age is almost malpractice?
Almost like the vibrations of the pneumatics, the heat, with the laser. It's actually tuned. The laser, the light is tuned to water. So there's water in between the cells of the teeth and the between the crystals, and it's targeting the water behind it. It pops off. It's not burning. It's not vaporizing. And then when you get to the bottom of the cavity, the sound changes. So
Mm-hmm.
this person, like, you don't figure this out on day one, but like, hey, I just finished this cavity, and like the frequency changed on the little explosion, and like, okay, we're done. Let's disinfect it. Let's ozonate it. Cover it up with a filling, and it's a lot. It's a lot less on the patient.
Yeah. It's the ultimate. I sure wish I would have this technology when I was a child.
Yeah, yeah, and
My
like
life would be a lot different.
a whole generation of kids, without that sound and without the numbing, without the needle.
Mm-hmm.
So that really changes things.
Do you even need local anesthesia because of it?
What's happened is that I'm able to use less intense anesthetics,
Mm-hmm.
especially without epinephrine. So we're
Mm-hmm.
doing these big surgical procedures with mild anesthetics that are a lot easier on the kidney and the liver, and it's easier to recover from. A lot of people go to the dentist and they get an injection. They're fine with the dentistry, but it takes them a week to recover from the injection.
Yeah, yeah, for sure. So, like any good professional, you're just not satisfied with your current level of training. You're continually seeking to update your skill set and getting continued education, as you alluded to now in Switzerland, I believe.
Yes, correct.
Yeah.
Yeah.
So, what do you see as some of the exciting advances that have just been out, and what's coming in the near future that we can anticipate?
Um, I I've been at this for a long time, and I thought more dentists would be catching on. I wish it continues to happen. There's not enough of us for the population that we have. The amount of chronic disease and long-term bad fillings and bad stuff out there. There's not enough of us. So outreach and education is a big deal. The new developments coming up is more acceptance of herbals, and better designs of implants. Now we're gonna be getting into custom implants more because of the 3D. We can see the shape of the jaw. We can
Mm-hmm.
order specific implants that better fit the anatomy and
Mm-hmm.
also the shape of the, because like what a lot of titanium implants, they look like a potato on a stick.
Mm-hmm.
So over time, they fail. They get a
Mm-hmm.
chronic illness, chronic inflammation, and now we're able to design ceramic implants that have a wider foundation, not just a cylinder. Big improvements in lasers are still ongoing, and again, just the delivery of the technology with 3D printing. We have a 3D printer now. I'm getting 50 microns, and we're able to do night guards the same day. The speed of dentistry is going up, and because our patients travel from far away, we can actually get them the stuff they need on the spot. And we're also able to do vitamin D test on the spot. So a lot of things have improved, so we can make better decisions on treatment.
Yeah, so vitamin D affects just about every tissue in the body, and certainly the teeth are no exception. So, what do you see the influence or impact of vitamin D on dental health?
When people show up with multiple infections, even just one, they're not at what they're supposed to be. They're usually below 30. They're always tired. They're lethargic. They can't get out of bed. And I will not do surgery on somebody that has low levels. We don't do surgery on people that come off the street. We are coaching them on how to improve their intake. We're doing intramuscular injections. We're connecting them with the right people.
You mentioned cavitations a few times. That's a big and somewhat controversial area, and I think in many cases it's abused. Certainly, the interventions, therapeutic interventions recommended, are less than optimal. So, why don't you give us your take on dental cavitations? First
Correct.
of all, what is it?
Yeah, I've been exposed to dental cavitations over 10 years. One of my mentors in Clearwater tuned me to it, and then I followed other mentors in Ohio and Washington. Um, uh, it's a reservoir of toxicity. So people will have a root canal on their last tooth, and the root canal has been releasing toxicity for a long time, and the body ends up storing that toxicity in a pocket of bone where wisdom teeth were improperly removed. Okay, so this is a source of inflammation. They are so wisdom teeth are removed what at 17, 19. There's 4 sites, and they do it in a rush. They don't remove the periodontal ligament. People have a chronic infection afterward, that secondary infection we were talking about earlier, and then but the body has to close, but the bone didn't form. So the body, when it gets exposed to toxicity, it's going to try to get it out of the body. If it can't do that, it's going to try to break it down to take it out of the body. But if you cannot get it out and the excretion pathways are blocked, it's going to shove it under the rug. And these pockets are weak resistance, and it's just a storage site. So we do a surgical. We first have to determine how many they are. So the CBCT maps the cavitations. Okay, so I can see the cavitation. Great, but is it active? Some people can't handle for these surgeries. It's expensive, and it's invasive. So then a tool that I've been relying on is thermography, where people used to go for, instead of mammography, thermography of the breast. Now we do thermography of the face and head. And when we do that, we're able to see that out of those 4 cavitations, only two of them, only one of them is active. You still have cavitations, but this one seems to have a hot area, chronic inflammation that's more active. Sometimes these act like layers of an onion. So, hey, I can't do all 4 of them. I don't have Lyme disease. Let's go ahead and focus on that one and see if we can get some resolutions. And then we just have the patient follow up on their thermography, like every 2 years kind of schedule, to see if we need to do any additional surgeries. So we try to keep less surgeries more.
And I totally agree, and which is, I think, the mistake that many clinicians who are aware of this issue use, and they overly uh, uh, aggressively overdo the surgery. And why don't you discuss some of the potential complications of that approach?
Okay. So when we do that 3D X-ray, there's a tunnel here, like that carries your jaw nerve, carries your artery and vein for your jaw. So we want to see that's protected and it has a like the tunnel has a covering. Some cavitations are severe and it eat away through that covering, and they end up causing neuralgia. So there's a whole group of people that have atypical face pain. And so we need to clean the tissue, flush it all out, disinfect it, but mindful of the nerve. And 10 years I've been doing this surgery. I've never had a nerve complication or paresthesia or full numbing of that nerve. So that's a possible complication. We always follow blood work to make sure that this person can clot adequately, and that they have low cholesterol and high D, because the entire goal of the surgery is to rebuild bone back into these pockets.
Mm-hmm. Okay, good, perfect. All right, so you thank you for sharing your wonderful skill set that is available to people who are in need of these types of dental services. And if people wanted to know more about you, what would they do?
They can check out our website at natural-smiles.com. We're located in downtown St. Petersburg, across from Mirror Lake. And our website has a lot of information. It'll have the Swiss Biohealth protocols. That's the recipe that we follow. And a lot of our patients follow Dr. Mercola, and we know that they're on the right track and being supported. Having that support, a true holistic doctor on the other side to help rebalance all this toxicity. Like I said, I hit the reset button, but now all this energy is going to flood back into the systems and it needs to be managed. So working with a holistic doctor like Dr. Mercola is the right way to go.
All right, perfect. Well, thanks for all you're doing, and keep up the good work.
All right. See you guys.
Thanks so much for watching. Remember, hit the like and subscribe button so you can get more videos that can help you and your family take control of your health.